Hello and welcome to the channel. The role of the government in health. Introduction to health and the government's role. Health in the democratic context. In a democracy, the government is responsible for the welfare of its citizens. This includes providing essential services like education, health, and sanitation. Health is defined as not just the absence of diseases but the overall well being of individuals, which encompasses physical health, mental health, social health. Physical health, adequate food, clean water, sanitation, pollution free surroundings. Mental health, emotional well being, and mental peace. Social health, the ability to participate in societal activities. Health and development. A healthy population is key to a nation's development. The government's role is not just in providing medical treatment but in improving the social determinants of health: clean water and good nutrition, air quality, housing, and education. Healthcare in India. Challenges in providing healthcare. India faces severe challenges in providing equitable healthcare, especially in rural and remote areas. Despite India being a major producer of doctors, the availability of healthcare services remains uneven across regions. Diseases like tuberculosis, malaria, and cholera still plague large sections of the population. Health disparities persist due to differences in urban and rural healthcare access, social status, and income levels. Healthcare growth. The number of government hospitals and healthcare institutions has grown over the years. From 2,717 hospitals in 1950, the number increased to 23,583 by 2017. India has become a major pharmaceutical hub, producing a large quantity of generic medicines and medical supplies. Despite advances in medical technology and infrastructure, large gaps remains in basic healthcare access for the poor. Types of healthcare services. Public healthcare services. These are government funded services provided through various health centers, government hospitals, and public health initiatives. Free or low cost services are provided to citizens, especially those from low income groups. These services are intended to provide preventive, primary, and emergency healthcare services, particularly for diseases like malaria, TB, cholera, etc. Challenges in public healthcare. Overcrowded government hospitals, long waiting times for treatment and medical procedures, limited resources, and sometimes a shortage of medicines and equipment. Private healthcare services. Private hospitals and clinics provide healthcare services that are fee based. These services tend to have better infrastructure, specialized doctors, and shorter waiting times. However, private healthcare is often expensive and can be inaccessible for the majority of the population. Quality of service. While some private hospitals provide world class treatment, many focus on profits and may recommend unnecessary tests and treatments. The cost of healthcare. Public healthcare. Public healthcare services funded by the government through tax revenue are designed to be affordable and accessible for all citizens. However, quality can vary significantly between urban and rural areas, with rural areas often facing shortages of healthcare and healthcare professionals and resources. Subsidized healthcare. Services like vaccinations, maternal and child healthcare, and basic treatments are usually available at minimal or no cost. Private healthcare. High costs. Private hospitals often charge substantial fees, making it unaffordable for the lower income population. Quality. Private hospitals often provide better amenities and faster treatment, but at a premium cost, unaffordable for many. Due to the high cost of private healthcare, many individuals borrow money or sell assets to pay for treatment. Profit motive. Many private healthcare services encourage unnecessary treatments or investigations to maximize profit. Aman versus Ranjan's experience. Aman, visiting a government hospital, faces delays, overcrowding, and long waiting periods. Ranjan, going to a private hospital, receives better amenities, faster treatment, and better care, but has to pay significant amounts, making it an option only for the wealthier sections of society. Healthcare and equality. Access to healthcare. Access to quality healthcare is unequal, with a significant disparity between urban and rural areas. People living in rural and tribal areas face additional barriers like geographic isolation, limited access to hospitals and clinics, lack of infrastructure, poor roads, lack of reliable transportation, and fewer healthcare centers. Economic inequality. The poor often can't afford private healthcare and may not be able to travel long distances to reach public hospitals. Impact of inequality. Women, children, and marginalized communities like Dalits and tribals face even greater challenges in accessing healthcare. Health insurance. Many low income families don't have health insurance, and out of pocket expenses can be crippling. Financial burden. People borrow money or sell assets, land, livestock to pay for medical expenses. Health expenditure is one of the leading causes of poverty in many Indian households. Kerala's healthcare system. Success story. Kerala's government has successfully prioritized healthcare, ensuring better access to basic health services across the state. Kerala's model focuses on community level healthcare through panchayats, that is, local governance, which distribute resources for health, education, and water supply. Key achievements. Kerala's health indicators like life expectancy, infant mortality rates, and maternal health outcomes are among the best in India. The state focuses on preventive care, that is, health education, vaccination, sanitation, rather than just curative measures. The state has one of the highest literacy rates in India, which contributes to its overall health improvement. Despite challenges like a shortage of medicines and hospital beds, Kerala's healthcare system has been able to achieve significant health outcomes. International example. Costa Rica. Costa Rica's approach to health. In the 1940s, Costa Rica abolished its army and diverted those resources toward improving education and healthcare. Universal healthcare system. Costa Rica provides its citizens with universal healthcare services, including safe drinking water, sanitation, and health education. The country has achieved has achieved remarkable health outcomes with long life expectancy and low infant mortality rates. Success factors: Costa Rica's focus on public health infrastructure and health education has resulted in widespread access to basic health services for all citizens, contributing to a healthier population. Conclusion: Government's duty to ensure health for all. Constitutional mandate: The Indian Constitution mandates the state's duty to ensure the well being of its citizens by providing access to essential services, including health care. The directive principles of state policy (DPSP) emphasize the improvement of public health, reduction of inequalities in healthcare access, and provision of basic health infrastructure. Ensuring health for all. The government must improve infrastructure, focus on preventive care, and ensure equitable distribution of health resources to address disparities. Governments must allocate sufficient funds to healthcare, especially in rural and underserved areas, to meet the health needs of the entire population. Key takeaways: Health is a broad concept. It includes physical, mental, and social well being, not just the absence of illness. Healthcare in India is marked by inequality. While public health services aim to be inclusive, many still face barriers due to underfunded systems and lack of access in rural areas. Private healthcare offers better amenities but is often expensive and out of reach for the poor. Governments must address health inequalities by improving infrastructure, ensuring quality care, and focusing on both preventive and curative measures. Kerala's success shows that investing in public health, education, and local governance can lead to better health outcomes. Costa Rica demonstrates that health can be prioritized over military spending, showing the potential of health focused policy to improve life expectancy and well being.